Causes of bleeding after a positive pregnancy test.
Hey there! Welcome to today's video, where we'll be discussing the possible causes of bleeding after a positive pregnancy test. It's important to remember that if you're experiencing bleeding during pregnancy, it's always best to consult with your healthcare provider to get a proper evaluation and guidance. Now, let's dive into the topic.
Implantation bleeding.
One possible cause of bleeding after a positive pregnancy test is implantation bleeding. Implantation bleeding occurs when a fertilized egg implants itself into the lining of the uterus. This can cause some light spotting or bleeding, usually around 6 to 12 days after conception. The bleeding is typically lighter and shorter in duration compared to a regular menstrual period.
Hormonal changes.
Hormonal changes can also contribute to bleeding after a positive pregnancy test. During early pregnancy, there is a significant increase in hormone levels, especially estrogen and progesterone. These hormonal changes can affect the blood vessels in the uterus, making them more prone to bleeding. This can result in some spotting or light bleeding.
Miscarriage or ectopic pregnancy.
Bleeding after a positive pregnancy test may be a sign of a miscarriage or ectopic pregnancy. Miscarriage refers to the loss of a pregnancy before the 20th week, and it can be accompanied by bleeding, cramping, and tissue passing from the vagina. Ectopic pregnancy, on the other hand, occurs when a fertilized egg implants outside of the uterus, commonly in the fallopian tube. This can cause bleeding and abdominal pain. Both miscarriage and ectopic pregnancy require immediate medical attention.
Cervical changes.
Changes in the cervix can also lead to bleeding after a positive pregnancy test. The cervix undergoes changes during pregnancy, becoming softer and more sensitive. Sexual intercourse or a pelvic exam can sometimes cause minor bleeding due to increased blood flow to the cervix. This is generally harmless and should resolve on its own.
Infection or cervical polyps.
Infection or the presence of cervical polyps can be potential causes of bleeding after a positive pregnancy test. Infections, such as sexually transmitted infections, can cause inflammation and bleeding. Cervical polyps are non-cancerous growths on the cervix that can lead to bleeding, especially during pregnancy. Both conditions require medical evaluation and appropriate treatment. So there you have it. We've covered some of the possible causes of bleeding after a positive pregnancy test. Remember, while spotting or light bleeding can be normal during early pregnancy, it's always important to consult with your healthcare provider to ensure everything is progressing as it should. Don't hesitate to reach out to them if you have any concerns or experience heavy bleeding, severe pain, or other worrisome symptoms. Take care of yourself, and thanks for watching.